welcome to Facebook Live, sort of. Tonight we've got a great topic, breast augmentation, and really my goals here are to go over the things that you are best to know before you go in for a breast augmentation consultation to get the most out of it. So why don't you go over a little bit about what that process is like?
Absolutely. So a couple weeks ago, we talked a lot about the initial call. So that's where your journey is always going to begin. So during that initial call, at that point, we're going to really be asking you questions when it comes to your breast to kind of figure out if you're going to be breast lift and augmentation, maybe just a breast lift or maybe just an augmentation. Now, of course, Doc's going to examine once you get in person, but we can kind of start that process on the phone.
So basically, it's sometimes we just don't know, right? Someone says, I want larger breasts, that means I need a breast augmentation. Mm-hmm. And so a woman's had children, or they've had weight change, or they've got just naturally a much lower, looser breast. They may think they just need an implant, and you're working to identify if that's likely to be the case or not. Of course, we aren't always going to know ahead of time.
Exactly.
Okay.
These are all the implants that we do offer here. And Terry, why don't you start with the little guy, the little saline one over there?
This is a saline implant, and it came out, Doc, was it 1962 that the saline implant actually came out?
Yeah, in fact, it's a very small percentage of implants that I use today, maybe 5% of patients. If you're a thin patient, I may not offer this at all. If you have a more significant breast tissue covering things, saline implant can be a good option. But we prefer the silicone for most patients because they do tend to feel much more like breast tissue and have much less visibility of the implant through the skin.
So the next implant is the silicone implant. Now the con to this implant is that you do need an MRI for maintenance.
Regardless of the implants, we need to monitor the breast. That I still recommend getting an MRI at least every 5 years. The reason the MRI is used, more so than mammogram, it's more sensitive at identifying if there's a rupture or a tear in the implant shell.
So also with the silicone implant is that it may move around the pocket over time. So Dr. Slenkovich, tell us a little bit about that implant and then when you would recommend a textured implant if you're too worried that this implant might move too much in the pocket.
So if you look around, you read around, you learn about other people that have had implants, one of the things we can see over time is needing to reoperate for a problem with the shape of the breast. And one of the things that's relatively common is that a smooth implant move in the breast, that it maybe move to the side or move to the bottom and give us a shape that we don't love. So bottoming out, the nipple's high on the breast, going to the side, we don't get fullness in the cleavage. We notice that when you're laying down, you need to have the bra to push the implant back up to the middle. That is definitely more common with a smooth implant. A textured implant has this fuzzy surface on it, and a textured implant tends to stay more at one with the breast, not move around.
When we have a smooth and a texture at the very beginning, would you say that recovery is the same? I mean, first week, incisions are healing, breasts are settling, but nothing over 25 pounds for 6 weeks. However, it is a little bit longer for the texture.
Dr. Slenkovich, what is this implant?
Yeah, that's a shaped implant or teardrop. So if you hold it up from the side there, you can see that it has that teardrop shape to it. It's fuller on the bottom. This is the bottom of the implant, thinner on the top. It turns out we don't use it much. It turns out that there are studies now showing that even plastic surgeons cannot tell the difference between who's had a shaped versus who's had a round implant. So for reconstruction, where you've removed all of the breast tissue and what's left is a tight skin envelope after a mastectomy for, say, a breast cancer or a preventative breast cancer type surgery, popular to use a shaped implant. And in someone who's like that, who has tighter tissues, thinner tissues, and wants a very natural shape, not a lot of roundedness of the upper breast, that's the primary person that I'm thinking about the possibility of a shaped implant. There's a range of cohesiveness available in the market today, and there are some that I think are just, honestly, they're too firm for most situations. So there's some of the very highest cohesive implants I don't actually prefer, but I do like some of the more cohesive implants, and I love that we have options. Okay, does that help?
That does. That's
You-
super
you-
helpful.
go ahead, ask your questions.
No, I was going to say, would you say, is this now the 5th generation of material that they have used for silicone implants?
Yeah, we've definitely gone on to the 4th and 5th generation of implants, and there are some differences among manufacturers, but we have very high quality implants available in the United States. If you go overseas, you may be offered an inferior quality. In fact, I've gone and visited the Allergan factory now twice. I've gone into their clean room where they actually dip and make the implants. Sierrah has built a U.S. manufacturing facility that recently just got its FDA approval. They're making all of their implants now in the United States. And the United States implants that are available are of the highest quality. Choosing implants then, we choose an implant. I may start with an implant that I think is a good option, but then I'll show it to you. Computer is calibrated, the side view can be very helpful. We'll look at that shape, and now we circle back. Is that a natural shape for you? Do you like that? I probably will show an implant that may be, in my mind, not completely natural, but now I want to look and see, is that what you're calling natural? And oftentimes someone will say, absolutely, I love that. I might want to look a little smaller, I might want to look a little bigger, and we start from there. So it's the great equalizer. And that 3D imaging, we've had it for more than 6 years now. It's something that I think makes a major difference in being able to communicate with the patient in terms of identifying what you see and what's in your mind and what we can see together, and now we can synchronize our discussion. It was really, really, the biggest help is honestly in implant size choice and satisfaction with choice. When we take pictures of patients, say 6 months after surgery, have them stand up next to their Vectra in the room, we can say, yep, we can see right where that size came from. Shape isn't always exact, and we even simulate breast lift. In fact, it's fantastic for simulating how a breast lift is done, how it looks on your body, but it won't always show exactly the shape we get for size. It's probably the most accurate. Thank you for joining us. You can always reach out to us again by phone, 303-783-1000. We're also on all of our social media at DenverBodyDoc. That's Snapchat, Instagram, and Facebook. Thank you for joining us. Plastic surgery is never the destination. It may be part of the journey for many. For all of you, thanks again, and enjoy your journey.